I welcome all the participants in today's Liberate.com Good MD series. The subject of today's talk is holistic management of post COVID syndrome. So, I welcome all the participants and convey my gratitude to Liberate.com for giving me this opportunity to share this august platform with all the learned audience. I bring this talk to you from SOHAM, that is the Society for Holistic Advancement of Medicine, which is dedicated to elimination of all sickness and promotion of positive health and total wellness, body, mind, and spirit by optimum synergy of the best practices of evidence-based science of modern medicine with the complementary drug-free modalities of recognized alternate or the traditional Indian, Chinese, the new age uh, systems of health. This gives us a huge opportunity. I am frequently asked this question, why holistic medicine? Friends, you all know that in spite of all the progress in the modern system of medicine all over the world, most of the common diseases in last 4 decades, their incidence or their morbidity has gone up nearly 3 times. And this present epidemic or the pandemic of corona has revealed that we know nothing about this new disease or this new viral infection. And it has created a large vacuum in trying to understand how to manage, especially these patients. And as the pandemic is keeping on growing, and especially it's picking up in our country, we know very little about it. So there is a need to put in all the resources to get the best out to save not only the lives of people, but the quality of their life thereafter. Of course, prevention is the best, and all our efforts should be focused on preventing the sickness, that is, the being infected by the COVID virus. And for that, while the whole world is waiting for the vaccine, friends, you all know that this vaccine is not going to come as a magic, or when the vaccine will come, what will be its limitations, what will be its efficacy, etc. We do not know. But sure, we have a very reliable method of developing our own self immunity, thereby improving our own health to create a an aura or a armor of self defense against not only the coronavirus but all kinds of infections. When we improve our own health, we not only prevent this sickness but save ourselves from all kinds of diseases. For you all know today that it is the lifestyle diseases, whether it is anxiety, depression, insomnia, diabetes, hypertension, heart disease, even going on to various hormonal disturbances, psychosomatic disorders, autoimmune diseases, even degenerative disorders, and so much so, even trauma is attributed to the stresses of the life by not regulating our own lifestyle. So it's a huge opportunity. In fact, I said this is a blessing in disguise. इस आपदा में वरदान है ये COVID-19, it has given us time to sit back and think, and it has given us time and opportunity to plan our lifestyles. And a good, healthy lifestyle can enhance our health and save us from all lifestyle diseases, and in the bargain, also prevent us from getting the coronavirus. Now, this lifestyle is not a it does not confine to any one particular system of medicine. In modern medicine, in the practice of modern medicine, we know it as conservative management. Whereas our Vedic wisdom teaches us the systems of yoga and Ayurveda, which essentially help to conserve our life force. And we have a marvelous system of acupuncture, which works on the same principle as the system of yoga. I, as a matter of fact, call it therapeutic yoga or accelerated yoga, which helps us. Just yoga is a way of life. Yoga helps us to improve our physical, mental, emotional, and spiritual health. Yoga gives us equanimity in life, combined with the Ayurvedic practices, especially of healthy nutrition. I say an Indian kitchen is a complete Ayurveda. You don't have to go anywhere to be looking for any medicines. In fact, today, the Ayush prescription for prevention against coronavirus, all these ingredients you already find in your home kitchen. So a judicious use of this, and when the things become little serious, become out of control, the initiation of the practice of acupuncture by expert medical doctors can save lives beyond even the most active medical interventions. In my own practice, I shifted more and more to the practice of acupuncture when I found the effect of the acupuncture needle bringing in results faster, more reproducible, and reliable than even parenteral, intramuscular, or intravenous administrations. So, a optimal synergy. I am a medical doctor, now 50 years in the profession. I'm very proud of my heritage. I must know my strengths, but I should be fully aware, you would agree, we must be aware of our weaknesses and how to overcome those weaknesses. And if we can overcome those weaknesses by complementing the various drug-free modalities of the other systems, which are also officially recognized. Now, for example, yoga and the Ayurveda, the whole world is adopting them. Acupuncture was given official recognition by World Health Organization way back in 1982 when it brought out a publication endorsing its use in nearly 300 clinical conditions. At the same time, the role of psychological counseling, supplemented with tapping of the subconscious, the deeper mind through the art of hypnotherapy, it gives us a beautiful combination to cure any disease. In fact, not only cure, to remove the very root cause of the problem, to restore positive health and total wellness. And that is what we can apply to the prevention as well as early cure, a good rehabilitation, and where the people have unfortunately gone on to suffer the post-COVID syndrome. You'll be glad to know, and I think it is for the first time ever, that Government of India has brought out a protocol for management of post-COVID-19 syndrome. This was issued on the 13th of September, that is a week ago. We had already planned this program nearly a fortnight ago, and it just comes out in time to coincide with that is the first time ever perhaps a Director General of Health Services, Ministry of Health and Family Welfare, Government of India says that to overcome this pandemic of COVID-19 and especially its post-COVID symptoms and signs, we must adopt a holistic approach. At the same time, it says that there should be no polypathy and there should be no drug interactions of the various systems of medicine. So this is what highlights what we are talking of holistic medicine, whereby a competent medical doctor, a qualified medical doctor, even if he has to use medicines, as far as possible, we may need to use no medicines. But even if we have to, when we complement it with the drug-free modalities of, as I've stated, of the systems of yoga, Ayurveda, acupuncture, psychological counseling, and hypnotherapy, that forms a combination whereby we are not creating any conflict or drug interactions, which is the objective of seeing to that no polytherapy, that means no drug interactions and the complications are created. So holistic medicine is absolutely a complete system. It complements the best of all the systems, and as far as possible, we need not use any drugs at all. Thereby, we observe the Hippocrates dictum, primum non nocere, who said, first make sure that you do no harm to the patient. You all know there is no medicine today in the world which comes without hazard of a possible side effect or a prolonged toxicity. So when we use no drugs, we create no harm and there is no iatrogenesis. That is one of the biggest advantages of holistic medicine. Now, holistic medicine does not require very sophisticated and expensive hospitals, etc. It can be practiced even at the primary care, at the root care level. The only need, what we need is under our Prime Minister's program of Skill India, that the healthcare workers, the doctors and the paramedical workers, etc., are trained in this art, that they can take care and most of the diseases can be prevented or cured early and even saved from going into advanced complications requiring any secondary and tertiary care. We have the world's best tertiary care facilities in our country. There are hundreds of world-class hospitals all over the country, but they are all overloaded with work. Their workload can be significantly reduced by following this concept of holistic medicine. Now, when the patients, fortunately in our country, we have a very high success rate, high recovery rate, that nearly 75, 78, 80% patients are recovering on their own, and very few people need hospital care. And by the divine grace, the mortality rate in the country is the lowest compared to anywhere in the world. And it's, I think, come down to nearly 1.5%, which is very significant and is a matter of celebration to the dedication of our healthcare workers, including doctors, nurses, paramedical staff, and everybody supported by the other supportive services. But even finally, if people do land up and it is being watched, so there are no available definite statistics, but it is being observed that more and more people are now beginning to suffer from what is being termed as post-COVID syndrome, which may include even after the patient has recovered, has been tested negative for COVID, but continues to suffer from sore throat, dry cough, tightness in the chest, or even shortness of breath. It's a matter of leading on to confusion, uh, tiredness, muscle aches, cramps, and that kind of symptoms. Because COVID is not that it affects any one particular system, it affects the whole body. It may create complications, whether it is through coagulopathy or vasculopathy or encephalopathy or uh, nephropathy. It can affect any organ system. But by regulating the life force of the individual, all the diseases are, as a matter of fact, because of disturbed life force. Human being is not a body. Human being is not merely its organs. Human being, as Hippocrates had well observed, that the greatest factor in our getting well is the life force in each one of us, which is the theme of our Vedic sciences, including acupuncture. Acupuncture actually has been a part of our Indian Ayurveda and has been known as Bhedan Kriya. And just as with the migration of Buddhism, all Buddha was born in India. He had his moksha, nirvana in India, and he never traveled anywhere abroad. But as his disciples spread across to the world, especially to the Far East and Southeast, they carried the wisdom of the Ayurvedic uh, uh, remedies of that period, and they spread out. And the Chinese royalty patronized what was the Vedan Kriya called then, and has been given the Latin name of acupuncture today. So it's very much a system of Indian and Ayurvedic origin. It's today even taught in the naturopathic medical colleges as one of the naturopathic treatments. But because of its official patronage or by the qualified doctors, especially the medical experts, not accepting it, it has fallen into quack hands. And even those people seem to be enjoying its fruits. And but the quality suffers, and as a result, the system of acupuncture is getting a bad name. So it is high time that our health planners and medical scientists come together to give recognized, because this system, it is recognized in many countries in the world. And as a matter of fact, holistic medicine is recognized in more than 25 countries in the world, and it is offered as a board certified specialty in the US for nearly 2 decades. So they are incorporating our wisdom into their practices, whereas we are falling and lagging behind. So it is high time we wake up to it, because holistic medicine, essentially, the word holistic as connotes expressing a wholesome care of health. Wholesome means taking care of the human being as a whole, as a body, mind, and soul. And the word wholesome, the W gets dropped, and the word holy gets highlighted. In other words, to highlight that human being is a spiritual being on a temporary physical journey. So if I manage my spirit or my spiritual health, my mental, emotional, and physical health automatically start repairing itself. And this body has got infinite power to replace the old with the new, and thereby eliminate the disturbance and restore the ease, and that is my health. So this is the essential uh, basis of this pathy. And when we restore this energy of the human being, we restore the homeostasis or the milieu interior of the individual. We restore the sympathetic and the parasympathetic harmony of the human system, and thereby our healing system starts picking up, and within a very short time is able to help remove all the disturbance manifesting as what we call disease or a sickness. And similarly, the same thing when I am suffering from uh, chronic fatigue, aches and pains is nothing but a sign of low energy, fogginess of the head or headaches. They're also because of deficiency of energy flow through my brain and my various tissues in the body. So they feel tired, that is perpetual fatigue. They get some of the people are today finding after having recovered from the COVID episode, they are finding difficult even to walk a few hundred yards. Or even in their home care, they need to breathe oxygen because they need more oxygen because their body is not picking up the vital life force. And that's what this practice of the yogic techniques and acupuncture techniques as a lifestyle and as a therapeutic means can help us overcome these deficiencies in a very short and quick time. And I would like to repeat here once again, it's an opportunity for us to recognize that this COVID 19 has been a blessing in disguise, that it has given us time to think and understand that human being is a spiritual being, and that is the life force. And if we nourish our life force, if we harmonize our life force, if we restore the equilibrium and restore our milieu interior, the healing is our nature, and we can help overcome. I haven't had any patient of COVID 19 syndrome so far, but in the past, we have treated lots of patients suffering from similar symptoms, which many people had very disabling disabling symptoms due to chikungunya, etc., and other viral problems. And even otherwise, today chronic fatigue, fibromyalgia is a kind of a very rampant problem in the Western world because of the modern stresses and the poor lifestyle is also now coming, and many youngsters in our country or what they call a burnout syndrome. You know, the young people, they work, as they say, a young man goes out, uses his health to create a lot of wealth, but in the meantime loses his health because the health has been ignored. And then they start running around to the various hospitals for medicines, but they cannot give them their health back. So it is in this context that this concept must be understood, that human being is an energetic being. This energy knows everything. That's called the human spirit, and we must develop and promote it. And it gives us the purpose of coming and sharing this platform with you all is to reinforce your confidence and to share with you that this deficiency can be very easily overcome, and within few days, instead this morbidity which may linger on for a very, very long time. And when the physical symptoms start uh, bothering over a prolonged period, the person starts getting mentally and emotionally upset, leading to various other psychological and psychosomatic problems, and gets into a catch 22 situation. So, all these problems are very easily controllable, even reversible, and as a matter of fact, go on to help such patients enjoy their health than better than ever before. This is my promise to you. Of course, there are Ayurvedic tonics, etc. But in brief, a good, healthy, sattvic, nutritious, simple diet is what we all require. Even though the Department of Ayush has recommended, and I don't think it creates any conflict with even if you're taking any medicines in the form of Ayushkwat, Giloi powder, or Samshadmani Vati, Ashwagandha, Amla fruit, in case of sore throat, cough, etc., Muleti powder, or warm milk with half a teaspoon of haldi twice a day, and hot saline gargles with turmeric and rock salt. In addition, Chyawanprash is a all-weather tonic. I can certainly propagate this better than any synthetic vitamins, etc., to take a tablespoon of Chyawanprash every day. So, with all this, I think I've spoken a lot, and I will expect a lot of questions from my friends, the participants in this program, and it'll be my pleasure to reply to your questions. Yes, please.
Yeah, thank you so much, Dr. R.K. Tulli. Thank you for sharing this, sir. It was an insightful session. So, as I can see, sir, there are many comments, but there is no question as such, sir. But
Okay.
doctors have appreciated and they have thanked you, Dr. Parveen Surti from Mumbai and Dr. Krishan Pal from Shamli. So, they all have appreciated for this and thanked you, right?
Okay. If there are no questions, let me summarize the talk of today. That this all-inclusive model of holistic Medicare helps us to contain the problem of COVID-19 at every stage. For example, by enhancing our health, we develop our immune system, which gives us a natural protection against the infection. And also, in case we develop the infection and during the active stage of the sickness, the holistic Medicare therapy will help us to recover much faster. And what is most significant is that it will at the same time help control our comorbidities. And as I've stated, this is a great opportunity for us to harness the benefits of holistic management of our health, because this helps to improve our quality of health. It adds years to our life and helps to overcome most of the lifestyle disorders, the comorbidities, which are in fact becoming the major cause of mortality in COVID-19. And then the people who may end up with residual post-COVID syndrome, for all of these symptoms and problems, by tapping on the life force of the individual, by enhancing the health of the person in very quick time, we can help overcome all these abnormalities, all these problems that COVID may inflict upon us. So, friends, holistic medicine is a wholesome, a complete, a harmonious, and a judicious method. And I can share with you that its results are very predictable, they're highly reproducible and sustainable for a long, long time, thereby qualifying it to be a very scientific process. Of course, let's all get together and do a lot of scientific studies to establish its so-called credibility, and that would be that would go a long way even to enhance the credibility of our profession. The revival of the old glory of medical profession lies in using the strength of modern medicine, but trying to fill up its very wide gaps with the complementary, drug-free alternate modalities of the various other recognized systems as I've enumerated. And with that, I'll sign off with a Vedic prayer. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया मे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्. That may no one suffer in any way and all beings be happy and healthy. And in fact, Soham, the, the motto of Soham is Sarve Santu Niramya. May all beings be disease free. Thank you very much and Jai Hind.